complain of they start of complaining of pain in forearm, arm, hand, fingers, shoulder, and neck. Even sometimes they go to partial, like they have paresthesias, hypersensitivities in that particular nerve in the area, and also they complain along with headache. So what we advise is to have a physiotherapy evaluation plus we allow homeopathic treatment along with it. That is the best, safest, and most effective way to treat cervical spondylosis permanently. Now, I'll tell you one of the few common remedies, but associated symptoms are very important. First, tellurium metallicum. Yes, tellurium metallicum generally it's a wonderful remedy for sciatica as well. But lumbar spondylosis also it's very important where there is excessive pain and stiffness and none other remedies response. Next, agaricus muscaris. Agaricus touch sensitive, very, very sensitive. Even the slightest touch cannot bear the pain. Agaricus, very much indicated. Theridion. Theridion is indicated in these kind of cases, cervical, where they complain of lot of nausea, lot of vertigo, and they tell you that they cannot walk, they cannot balance themselves while walking. Phosphorus. Phosphorus is a wonderful remedy for cervical spondylosis where they complain of vertigo. Generally, they tell you if they stoop forward, they get vertigo. So they cannot, from rising from stooping position, it's very worse. So, irrespective, even if you're dealing with Meniere's disease, phosphorus works with these symptoms. Even you are dealing with cervical spondylosis, this symptoms works. So it's all importance given to the particular symptom of that remedy, then only, no matter whatever the condition is, the remedy has to act. Here in cervical, there is more involvement of the right arm and hand, all the numbness, numbing pain from the neck. Nux vomica has a sharp pain in the first dorsal vertebra. First dorsal vertebra, you find the pain. Auramure gnat, the pain occurs only in neck movement. And acid frost, we will go in more details about acid frost. Acid frost is also a wonderful remedy for cervical spondylosis with physiological symptoms. Dalkamara, so neck pain, stiffness in the damp, wet weather. Dalkamara. Now, these are the general remedies which all have cervical spondylosis symptoms. I'll just go one by one. Actia spicata, especially in small joints pain. Agaricus, like I told you, lot of twitching, spasms. Angostura vera is a wonderful remedy for avascular necrosis. Also, one of the most important remedy in avascular necrosis, Angostura vera. And Angostura vera has typically a lot of stiffness. So Angostura vera is a combination of Nux vomica plus Ruta. So Nux vomica like irritability, desire for coffee and stimulants plus Ruta like stiffness. That's equal to Angostura vera. Okay, I hope now no one will forget Angostura vera. Argentum metallicum, chronic pain, tissue degeneration, like even argentum metallicum, we call it cartilage regenerator of the in osteoarthritis cases of knee joint. So argentum met has lot of tissue involvement. Arnica, trauma-related pain, belladonna, there is throbbing pain, benzoic acid along with gout and stiffness. Calcarea carb, there is lot of issues with joints. Calcarea fos, bone and growth problems. Chamomilla, irritability. Causticum, there is lot of contractures. Cicuta, when we talk about, there has to be spasm, there has to be convulsions. Semicifica, when we talk, there has to be stiffness and lot of muscular pain. Coculus also has lot of vertigo and lot of weakness in the limbs, in the upper as a lower limb. But ailments due to caring of others, excessive caring of others, not thinking about themselves. They all complaints of coculus start of caring the sickness, caring the sick person for years and nights, having sleepless nights, caring the person, and then the symptoms get aggravated. The only remedy is coculus indica. I think I can. I think everyone can hear me. Is it?
Yes, sir.
Yes.
Yes,
Okay.
sir.
So more remedies we discuss: colchicum, dulcamara, guaiacum, kali iode, lecnanthus, natrum carb, nicolam met, phytolacca, muscle soreness. Phytolacca has muscle soreness. Pulsatilla has wandering pain. One second, please. I'm sharing the links for the people who could not join this session, so that will be easy for everyone to join and witness it. One second. Okay. So Phytolacca, pulsatilla. Pulsatilla, I would like to tell you, wherever you find the changeable symptoms, patients comes and tell you ear pain, ear pain, ear pain. Changeability of the pain locations, that implies to pulsatilla. Next, rhododendron. Rhododendron, worse in cold, damp weather. Rustox, stiffness, worse in cold, damp weather. If there is stiffness, there is rustox. Urtica urens along with urticaria complaints. Stellaria media is a wonderful remedy for rheumatoid arthritis, like pulsatilla like pains, but they have typically in small joints. Stellaria media. There are a lot of cramping pains. Strychnine has a lot of spasms, and Sticta lot of stiffness, rheumatic stiffness along with all joint pains. So spondylitis complaints in drunkards, you find these kind of remedies, all remedies included with their withdrawal symptoms of alcoholism. You can find agaricus, entimtart, arsenic, aurum calcarea carp, china, semicifuga, cocculus, colchicum, iodum, lachesis, ledampal, lycopodium, nux vomica, pulsatilla, ranunculus bulbosus, and sulfur. See, the reason I'm showing these all remedies, as you can correlate with their symptoms and their the history of alcoholism. So this can actually help you in combining a totality and then prescribing. You won't be confused on choosing the specifics. You will have a thought that okay, that remedy will cover that his alcoholism or not. So that's why these all remedies are very much indicated. In cold damp weather, causticum, colchicum, dulcamara, hippocsulf, kalicar, nux moscata, nux vomica, phytolacca, agaricus, arsenic, these all remedies are important in spondylitis complaints which gets aggravated in damp weather. So these all remedies has to be considered. Of course, they have their individual symptoms which has to be evaluated after case taking. But these are the most remedies which are very important. Okay. Pulsatilla also, Rustox, Sarsaparilla, Stillingia sylvatica, Strontium carb, Symphytum, and Tellurium as well. Now, spondylitis complaints affecting the heart with palpitation. So these people will come that they have a lot of palpitation along with spondylitis. So Adonis is one of the beautiful remedy. Cactus, Simicifuga, Crataegus, Colchicum, Brynia, benzoic acid, arsenic, abrotenum. These all are remedies very important where along with spondylitis they tell you they have palpitation issues in the heart. More remedies, Calmia latifolia. Of course, it's a heart remedy. Lithium carb, Lycopus virginicus. Along with Lycopus is a wonderful remedy for even high blood pressure, where the patients tell you that they feel the palpitation is very much higher. They feel that they can actually feel the palpitation. Lot of palpitation plus hypertension is equal to plus thyroid is equal to Lycopus virginicus. This way you have to remember this. Natrium muraticum, there is a lot of water retention plus grief history, phytolacca, phosphorus, rustux and spizelia. These all has spondylitis plus heart complaints plus palpitation issues. Now, to begin with the first remedy, which is very important in cervical spondylosis, amon carb. Amon carb has severe stiffness in the neck and upper back, which get worse by cold. And the pain is worse on draft of air. So, aggravated by cold air, you will think of nux vomica, you will think of hypersulfur, but you won't think of amon carb. So, keep a note of it. Next, amon muraticum. Amon mur is I know it's a abused remedy typically in left-sided sciatica cases where they tell you, sorry, they have lot of pain in the thighs. They cannot, and the sitting is very worse. They cannot sit. So sharp pains in the lumbar area, pain radiates down the legs, and feeling worse after long periods of sitting. So long sitting, prolonged sitting aggravates the complaints like Rustox. That is Amormur. And Amormur typically it is been abused for left-sided sciatica cases. But believe me, there are more remedies to look out. But yes, keep in mind about Amon muraticum as well. Now, these patients with difficulty in straightening up after bending. So once they get bent, they cannot straighten up. And they have cold aggravation as well. Anagallis arvenicis. Anagallis we all know for Pomfolix dyshidrotic eczema in hands, है ना? In skin diseases, it's a wonderful remedy for Anagallis. Even in psoriasis, it's a wonderful remedy. But what about the cervical spondylosis cases? They have stiffness, numbness in the cervical spine extending to arms. They have tingling sensation worse in cold weather, that is winter here. Patients with nerve related discomfort in the cervical region, it is the very indicative remedy. Bambusa is has lot of stiffness here. So Bambusa has a picture of ankylosing spondylitis, lumbar spondylitis, cervical spondylitis everywhere. It's a universal remedy. But the key entry to this remedy is stiffness. Lot of stiffness. Stiffness as of the spine is as stiff as like a bamboo. So much of stiffness. It's made up of bamboo. Bambusa has so much of stiffness they cannot neck. The neck will be like this. They cannot turn here and there. This cervical spondylosis or in ankylosing, when the neck becomes so stiff, they cannot move. The bony spurs in the spine, bambusa. If that fails, I'll tell you the next remedy we'll discuss today. So if there is stiffness in the spine, you think of bambusa. And it is very difficult for them to turn the head. Damp cold weather aggravates, and there is lot of rigidity, the spinal rigidity, especially in upper cervical region and lower lumbar as well. Now, in torticollis cases where there is excessive contraction in the neck muscles, we can use bambusa, but as well as in lumbar spondylosis cases where Rustox is not at all helping, and the patient will come and sit, and in whole history he'll be more focused with the stiffness. Give bambusa, it will resolve your case. Okay. 30C is very effective. See, potency, this in acute, I like to clear. You can use LM, centesimal, and 200 as well. I'll explain you what all remedies are more important in the slide only. I'll tell you what potency can be given. It is very helpful. And secondly, the repetition is totally based upon the severity of the cases. Okay. So Coculus indica, like I told you, it should cover the vertigo. vertigo when sitting up or turning the head, even vertigo when looking at the moving object. You know, when you go to a when you stand in a railway crossing and the train crosses, when you focused to watch that train, you start getting vertigo. This is coculus. This is coculus. So likewise, this all common points are very important in verifying the drug. And I hope this makes you very clear with when to prescribe this remedy. It is a wonderful remedy for cervical spondylosis and knees, lumbar spondylosis as well, where knees give away. Like they don't have strength to stand, they don't have strength to walk. So these all. The Coculus is a wonderful remedy involvement with CNS and the spine. So you have to read Coculus for more details as well. Colophyllum, the all small joints pain in the neck and the lower and the stiffness, especially for women who aggravate during the hormonal changes period. You can think of coculus. Coculus have all small joints pain and they have stiffness. And colophyllum, colophyllum I'm talking about. Colophyllum, I'd like to tell you one of the most confirmatory symptom. Colophyllum people will come and tell you that if I close my fist, if I make a fist, I cannot open them back. It is so painful, doctor, so painful. I cannot open them back. This is colophyllum. Okay. Coniamac. Coniamac, again, for vertigo cases along with cervical spondylosis. Even slightest turning the head causes immediate vertigo, very severe vertigo. Stiffness worsens with immobility, especially in old people in conium. And there is loss of strength in the limbs with neck stiffness. This is very marked. And even in Meniere's disease, it's very helpful. Conium Mac. Calcarea ars. Lot of burning pain in burning spinal pain with degeneration. Lot of weakness and fatigue. Even in cervical spine, they have a lot of burning sensation that worse at night. Elderly people with deep tissue inflammation, and along with that, calcarea ars has a marked uh, keynote of palpitation from anxiety. That is calcarea ars. Even they walk the stairs, they have a lot of palpitations. So calcarea ars, along with this burning in the cervical spine area, indicates Costicum. Costicum has lot of ligament pain, especially in the back and neck. Deep-seated pain that feels better by warmth. Chronic back pain in individuals prone to nerve inflammation. Think of Costicum. Costicum people have aversion to sweet. They have a lot of aversion to sweets. So if there is no sweet desire, then you can think of Costicum. Calcarea calf. Calcarea calf has lot of rigidity and stiffness. They are flabby, fat people, and they have lot of craving for sweets, delicacies, but they cannot tolerate horror movies. They have fear of dark. They cannot watch horror movies. They are very sensitive people. Cannot watch violence on the TV. This way, Calcarea calf rule out a lot of the things. So talking here the difficulty in turning and the turning the neck, the lumbar, the spine, the rigidity, stiffness, and they get strained easily. They get fatigued very easily. They complain, doctor, I don't have energy to work. I'm exhausted. This all laziness and this indolent, uh, this all nature reflects calcarea carb more. Now, carbo animalis and natramur is one of the two remedies which are very helpful in reduced intervertebral spaces in cervical region with presence of osteophytes. And they complain, both the remedies has this pain in right in forearm all the time, paroxysmal numbness in the hand with pain in upper arm when lying on it. So when they lie on it, they have a lot of pain. And carbo animalis, one to differentiate between natramur and carbo animalis is relieved by warmth and natramur doesn't get relieved by warmth. This is a major difference in two. Now, wherever there you find a case of neuritis of break, where there is the complaint of partial paralysis due to neuritis of brachial plexus, The only remedy which can help that is croton take. Yes, croton take we all know, diarrhea alternating with eruptions and everything, diaper rash, and it works in numerous skin cases. Agreed. Even in lichen planus, wonderful. But in brachial plexus, proton take one of the most important remedy where there is partial paralysis. Semicifuga. Semicifuga is for all the IT professional and stenographers who sit for hours. So they complain of stiffness and pain in neck. Think of semicifuga. Fluoric acid. Acid fluor is have lot of where acid fluor is the, let me tell you, acid fluor is the hottest remedy in odd mathematica in because all the acids are chilly. All the acids are chilly apart from two acids, that is fluoric acid and picric acid. These two acids are only hot thermal wise to remember. I hope this makes easy now. All the acids are chilly. Fluoric acid and picric acid is the two hot remedies. They are hot, thermally hot. They cannot tolerate hot. So they have bony growths in fluoric acid and degenerative state, but they complain of internal heat, which often feel in cervical spine region. So, case of degenerative cases where there is a lot of spinal tenderness, burning in the spine, you can think of acid floor as well. Guacam. Guacam is one of the beautiful remedy for rheumatoid arthritis, for osteoarthritis, where the knee cannot bend. And in cervical spondylosis, there is a lot of stiffness in the upper spine. They have sharp stitching like pain in the nates, in the buttocks. In the buttocks, they will say you, doctor, something is pricking. There's some stitching pain in my buttocks and nates. That is guacam and conium, two other remedies in there, but guacam is also one of the very marked remedy where they complain of stitching pain in the nates, in the buttocks. Pain feels better with warmth, but worse with touch. Now, in knee case, guacam aggravates by warmth and better by cold. In knee case, not in the cervical case. So, patient who feel restricted movement in the cervical spine, guacam could be one of the remedy. Kali carb. What to tell you about this remedy? Kali carb has lot of stiffness in the upper back, and they have lot of weight, sensation of weight area in the spine here. They get the most characteristic of this remedy is the stabbing and stitching pain, which aggravates in midnight from 1 to 4 a.m., 2 to 4 a.m. They have sharp pains. Along with that, they have a lot of exhausted feeling. And Kali Carb is one of the remedy which aggravates after coition. Yes, whenever they have sex, after sex they complain of lot of backache. Simply give Kali Carb. It will miraculously cure that case. We have treated so many cases, even in IPDs, where the patient will tell you that I have a lot of back pain, back pain, back pain. When you take up the complete history, they will also tell you that doctor, I have pain after having sex also. I have a lot of back pain. Give Kali Carb. Kali iode. Kali iode has deep pain in cervical spine, which aggravates at night because it's syphilitic remedy. Even in the spine area, they complain of lot of pain in this, especially in the right-sided sciatica. They limp, they force limp. They limp and they walk, they feel better. But they do not walk, they are worse by still. They are worse by still. They complain, they cannot be still due to the pain, but they walk, they feel better, and they complain that the lying on the fitted part is worse. This is Kali out in upper part also and in the lower part also. They are very, very restless people. Kalmia latifolia. Now, I'd like to tell you something. Whenever you find in cervical spondylosis, there is more tingling pain, sharp shooting pain to arms and hands, especially right-sided, and where you see the area affected is C5 and C7 vertebrae. Kalmia is your remedy. And they'll complain of tingling in fourth and little finger. So this is typical of Kalmia latifolia. You can think of this remedy in this condition. Lecnanthus. Lecnanthus is a wonderful remedy for stiffness of the neck. Okay. Stiffness of the neck, more on the right side. That doesn't mean that it doesn't work on the left side. It does work. but stiffness is the main entry point of this remedy. Right-sided stiffness, tingling, numbness, weakness, aggravated by any movement and relieved by rest. Think of Lechnanthus tinctora. Tinctoria is a wonderful remedy in cervical spondylosis. Paris quadrifolia. Paris is another remedy which has lot of tingling and numbness, which radiates to the little finger and the fourth finger as well. On the left sided, they complains of lot of pain and weakness. Weakness is very much important here. So likewise in Lechnanthus, there is lot of stiffness. Paris has lot of weakness. So this way you can correlate. Lot of weakness in the muscles of arms and hand due to the nerve compression. So cervical spondyl right-sided affinity is Lechnanthus, and Paris quadrifolia is left-sided. So like I told you, Lechnanthus has lot of stiffness. Paris also has stiffness, but Paris has more of tingling and weakness. So that is very important to remember here. Miserium has lot of pain that goes into the bone pain. Lot of bone pain and draft aware aggravates. Pain extends along the nerve, often with a sensation of burning and itching. Of course, Miserium is a wonderful remedy for post-herpetic neuralgia, burning pains. So all the pains wherever there is burning along with or itching sensation, you can think of Miserium. Chronic spondylitis with nerve pain degeneration, where the skin is overly sensitive, you can think of this remedy. Now, another remedy is Nicolam Met. Nicolam Met is a wonderful remedy for cervical myelopathy cases. We have found tremendous results in these cases where the patients tell you that they have lot of stiffness by prolonged sitting and looking down for lot of time. If they are looking down, the neck is down, they complain of this particular area of lot of stiffness. Then this remedy is come to the rescue because they have a lot of dull pain and they tell you that they have a typical sharp piercing sensation. And in fact, they also have a concomitant symptom. They have a metallic taste in their mouth. Along with so neck pain plus metallic taste in the mouth and sensation of heaviness in the neck, in the head, you think of Nicolam. This remedy is a wonderful Hiramaya disease also. Yes, in Hiramaya disease also it has been found wonderful results used in cervical myelopathy cases. So those who are the desk job people, they often find this very commonly, this type of pain. So you can think of Nicolam in these cases. Daphne californica. Daphne californica is one of the remedy where they complain of stiffness of the neck which radiates downwards. So from here it radiates downwards. So they complain of dull ache in occipital and cervical region which extend down to scapula. Great heaviness of the head is most important keynote here. They'll complain of great heaviness of the head, which however gives no relief. They feel like constant move the head, but it doesn't ameliorate. It doesn't ameliorate. They have a feeling that I should move the head to feel better, but it doesn't get better with movement. Acid phos in every repertory you find acid phos. To how to confirm now acid phos must have been prostrated. Acid phos must have a history of vital fluid loss like China. Acid phos will have a craving for fruit juices, not fruit juices. They'll prefer to drink the juice rather than to eat the fruit. This all differentiates with all of the remedies. So if you confirm this in your clinic, you'll get to know if you prescribe acid phos or not. Now, acid phos has numbness all over the radial nerve. So all the radial nerve distribution are involved. Think of acid phos, where the patient tell you that I am mentally and physically both the areas are very, very drained. I don't have energy to neither to think, neither to work. So young adults with signs of degenerative disc diseases often brought by mental stress and physical overexertion when they cannot take what we call today's generation Gen Z generation. They may require this acid phos. And if you find the rubrics, these all rubrics in back spine spondylitis, you all rubrics you'll find acid phos, acid phos, acid phos. But acid phos involvement is more over the radial nerve distribution, so you have to see this and then you can prescribe. Phytolacca. Phytolacca has stiffness in the neck with radiating pain to the shoulders. Throat pain often accompanies the spinal discomfort, ideal for cervical spondylosis with deep-seated and shooting pains. So phytolacca is actually between Brainia and Rustox. So when you find a Brainia-like modality and Rustox-like modality and you are confused what to give, simply give phytolacca. Phytolacca has more involvement of throat. Definitely deglutition is difficult due to swelling in the throat. They have a lot of pain, but they have as same stiffness as Rustox has. Phytolacca also. Phytolacca is more of aggravation from the lying on the affected part. Rustox, when you find pain from false position, any wrong position, any wrong position, the pain aggravates. Rustox is one of the remedy. Better by warmth application, worse by sitting and exertion. Sankan. Sankan has sharp pain in the neck which radiates on the right shoulder. So these people, that's why Sankan has very much marked on right-sided frozen shoulder. So if you give Sankan on the right-sided frozen shoulder where the patient complains of the intolerable to odor, they cannot tolerate to perfume, they have headaches from perfume. They cannot take any form of along with yes, Sankan is one of the remedy where has headache, asthma with gastritis complaints also. So they have a lot of headache plus gastritis complaint, even asthma tendency, which aggravates due to the odors. So Sankan, along with this sharp neck pain, the shooting in the right shoulder, they have pain in lifting the arm, one-sided symptoms of cervical spondylosis, one of the beautiful remedy to think of. Thuja has everything. A psychotic remedy has everything. Chronic spondylitis cases, lumbar, cervical, lumbar, or whatever you find. You
Hello, Dr. Jitesh, can you hear me? I guess there is some network issue. Just wait for a few seconds. Kindly wait for some time. So, dear all, whoever is asking for recording, this session will be put on YouTube channel of Asha Homeopathic Academy. I have already given the link in the chat box. You can subscribe that and you can watch the session. It will be there. Don't worry. Yes, you can ask questions at the end. We will take questions at the end. So whatever you want to ask, please write down that in chat box. And okay, revive of basics 5 session. Yes, it has not been uploaded yet because um, the editing is not over. So we will put that very soon. Don't worry. Yes, I will share the YouTube channel address. I will send the link only. Oh, sorry. Yes, you should wait. Please wait. Dr. Jitesh just informed me there was a power cut. So his internet just got switched off. He's joining back. Don't worry. इसकी रिकॉर्डिंग आपको YouTube चैनल पे मिलेगी। मैं उसकी लिंक आपको भेज रही हूँ। आप उसे सब्सक्राइब कर सकते हैं सो दैट आप लाइव सेशंस में जाके उसे देख सकें। दिस इज द लिंक। Sorry, the PDF won't be shared, but the session you can watch on YouTube.
Hi, sorry, there was a power cut.
No problem, Dr. Jitesh.
Yeah,
Welcome back.
thank you. So, shall we continue now?
Yes, please go ahead.
So, I was speaking about Thuja. Thuja is a wonderful remedy for chronic cases of where you find cervical spondylosis, lumbar spondylosis, but the most accompanying keynotes of Thuja is the fragility, the dreams of falling, the dreams of falling from high places. These all mental sphere, very religiousness, aversion to onions and desire for onions in the food. These all little differentiations will actually lead to select the remedy called Thuja. But along with this, you will keep on complain of lot of chronic weakness in the joints, a lot of weakness. So they're very fragile, like so they're very fragile remedies. So they'll keep on complaining, this is very getting weak, doctor. This is very to keep on complaining along with this weakness symptoms. They have lot of soreness in sacrum or lumbar area. So you can think of Thuja along with this. Now I'll discuss modalities, right, of modalities differentiation. So pain relief when lying on the affected part, bryonia. Bryonia gets pain relief on lying on the affected part. So wherever his patients complain that if they lie down on the affected part, they feel better. That is bryonia. Phytolacca aggravates when lying on the affected part. When next stiffness in the neck, wherever there's stiffness in the neck, two remedies think very common to Ruta and Simifica. Ruta, especially in the computer users, mobile users, also Simifica is also. But what happens? Ruta pain gets ameliorated when they lie down. Simifica still complains when they lie down. They complain of lot of pain. Cervical spondylosis, when the looking up gets worse, pain gets worse, graphitis, stooping, Rustox, coughing, sulfur, turning, Asculus agaricus, bryonia, sulfur, and of course there are other remedies as well. So turning on the right gets aggravated, Sancan, Kalmia, Lechnanthus. Left-sided conium paris. So how do I do this? I'll tell the patient, cervical spondylosis case. I tell the patient, okay, do one thing. Put your hands above like this, and you turn left like this to turn right side and tell me. So if he has a pain on left side, he'll tell you, sir, I have pain this side. So immediately I prescribe on that basis. If I tell him to do like this and he'll complain this side pain, then of course I'll think of right-sided remedy. This way it is very easy to differentiate. So all the remedies which contains ulnar nerve area, the sphere of action, Simicifuga, Paris quadrifolia, Rustox. These three remedies have very strong affinity for ulnar nerve issues. So we can think that way. Pain extending areas. Now the patient will tell you that I have pain extend to arms and fingers. So Kalmia, Naxomica, Paris quadrifolia. Only in arm, Natramune, Naxomica. Clavicles, Gelsemium, Natrum Sulf. Eye, Cilicia. Head, Carbovage, Ferromate, Paris quadrifolia, Pulsatilla, Cilicia. To occiput, Ferromate, Gelsemium, Natrum sulf, Phytolacca, Cilicia. Of course, you need to differentiate it, but these are the remedies you have to look for. Between the shoulders, Epismel. Shoulders, right shoulder, Aconite, left shoulder, Borax, and Ranunculus bulbosus. So, in cervicalgia cases where they campaign only on neck pain, neck pain, neck pain, neck pain. Draft of air aggravates. Nux vomica is one of the remedy. You can use 12C. It's wonderful in this type of cases. And Cilicia and Rustux, where symptoms agree, like Rustux, any cold, any damn cold weather or any sprain, and Cilicia, due to his chilliness of all complaints and rigidity, by his mental rigidity, you can think of. And cervicobrachial neuralgia cases where you have sharp shooting pain in the right hand, of course, that's a remedy is Calmia latifolia. In 6C, it acts wonderful. Now, to start ankylosing spondylitis cases. Ankylosing spondylitis cases is very common in individuals nowadays from 20 to 30 years, particularly males affected. Spine, sacroiliac, hip joints, knees, ankles affected. Pain, stiffness. They complain of a lot of stiffness and pain. They cannot flex more and they have a lot of fatigue in the body. The first remedy I would like to tell you for ankylosing is calcarea phos. You prescribe an LM potency, it will give result. Best LM potency or 6C. So calcarea phos, now how to confirm if there is calcarea phos? Of course, the constitution you have to see. Very much thin calcarea carb is calcarea phos. Okay, thin calcarea carb is calcarea phos. Stoop and long body, tall. You find calcarea phos. So calcarea phos, they'll complain that doctor, when I rise up in the morning, I cannot make my lumbar the spine straight. This particular symptom is of calcarea phos. Typically, if you are dealing with ankylosing spondylitis cases, it will never ever disappoint you. Okay. So calcarea phos has nape of neck pain, cervical region as well as sacroiliac region. Calcarea phos will actually clear up your ankylosing spondylitis cases. No wonder how much serious it is. So calcarea phos also has lot of involuntary urination where if there is a tumor in brain or in the spinal, you can think of calcarea phos that way also. Colchicum. Colchicum, as we all know, दूसरी की करनी उसको भरनी है. So ailments from misdeed of others, the suffering due to misdeed of others, that's colchicum. Pain with ankylosing in the back and neck, lot of stiffness, burning pain, non-inflammatory chronic rheumatism of hip and knee, non-inflammatory. So there is no inflammation, but there is a lot of rheumatic pains. Plus, you find this amelioration from heat and rest and aggravation in cold and damp from evening to morning. So they complain from evening, from the evening till the morning, they keep on complaining. This is colchicum. Of course, nausea from odors. They cannot tolerate the odor of the food. They complain from nausea. These all are the concomitants of selecting colchicum, of course. Butyric acid, butter. Butyric acid has lot of pain in the small of the back, which aggravates during walking. So in the early morning, they cannot rise up from bed only. They cannot rise up from bed because see, first it is acid. All acid have prostration. They cannot, they'll keep on complaining of fatigue, weakness because of the prostration acid. Second, butyric acid, especially in ankylosing cases, they cannot rise up from the bed. They have so much of pain and the pain goes down the back and the limbs. So it's a wonderful remedy in cases where they are a lot of tired and fatigue feeling and they have a lot of pain in the back. They cannot rise up only in the bed. So think of butyric acid. Okay, this wonderful remedy is very difficult to procure because it doesn't available everywhere. You have to order from Helios or from outside. This remedy is an boon in cases you are dealing with a stubborn cases of backache. Any stubborn cases of backache where you're stuck giving all any of the remedies I'm teaching today, any of the remedies, this remedy will actually clear up the case. The name is tuberculinum recidum coach. Tuberculinum recidum coach. the stiffening of the vertebral column in antrolisthesis cases, in retrolithesis cases where you're stuck treating. This is the remedy to rescue. Rheumatism, they have a lot of stiffness along with it, and any movement aggravates. Any movement aggravates. So this is a remedy. Now, bony spur in spine, the osteophytes I'm talking about, calcarea floor, and this remedy is very indicative. That is called as polygonum multiflorum. It is an instant reliever in ankylosing spondylitis cases as well. Instant reliever. Polygonum multiflorum is the remedy. How do you differentiate that? They have a lot of spurs in ankylosing spondylitis, like stiffness, like rustox. You can think of polygonum multiflorum, and you can use in 30C if everyone is keen to know the potency. Asculus hypocastum is wonderful remedy in sacroiliitis cases where the sacroiliac is more involved, which will you think of rustox or sepia. But sacroiliac backache, which is relieved by standing, okay, which is not right-sided, then only you can think of asculus hypocastum. Asculus has a concomitant symptom of piles history. That's okay, but it's not necessary you'll get every case of piles. But yes, if you get the piles plus backache, it's asculus only. Now, how do you see in a clinic? The pains are excruciating, forcing the patient to bend, and mostly an apparent when in motion. On rising from sitting, when he tries, he gives lot of attempt of sitting, of rising from the seat, and he cannot get up. After several attempts, he just is able to get up from a seat. This confirms that you have to give Asculus, and you will never get disappointed. He cannot raise his body and has to walk bending, pains on stooping, walking, and they feel as if the back would break, as if sacrum is broken. This particular feeling is asculus. And in Pile's cases, let me tell you, asculus has scanty bleeding, not profuse bleeding. Collinsonia has more bleeding. So this way it is differentiated. Entim tart is a wonderful remedy to clear up all the marks of chicken pox in the body, and they have lot of breaking pain in the back. They have breaking pain, backache, we call it in entim tart. So in acute diseases there is lot of backache. You find of entim tart one of the important remedy. Cobaltum metallicum. I'm sure cobaltum, many of the people might be have used. Cobaltum is wonderful remedy for backache followed by seminal emission. So whenever there is profuse history of seminal emission and they complain of lot of backache along with it, give cobaltum. Now, how to see cobaltum? Cobaltum has a very severe backache which is worse on sitting, as similar as agaricus, berberis, cannabis, rustox, sepia, valeriana, and zincum. They are relieved by walking, by lying down and standing up. But if they sit, the backache is worse. You think of cobaltum, and the case will be clear. So they have, along with cobaltum, symptoms are they have a lot of weakness, limb trembling, foot sweat, and signs of impotency as well. Cistus canadensis. Cistus has a lot of burning, bruised pain in the coccyx, preventing sitting. So whenever you deal a case of coccygodynia, yes, you deal with coccygodynia cases, and the patients are telling like they cannot even sit. They have so much of pain. You will think of asculus, you'll think of hypericum, you think of lot all remedies, belladonna and everything. Nothing works here. Only one remedy will rescue, that is cistus. The most confirmation question of cistus is desire for cheese. If there is, you can think of sisters. Cotyledon is one of the neglected remedy, you can say. Nobody knows much more about it. But yes, I have treated so many cases where the patient tell you this particular area in the gluteus maximus, they have stinging pain as if needles, as if something is stinging inside. Stinging. The burning stinging pain of like epis, you remember? So that same kind of stinging pain in the gluteus maximus in a sciatica, I'll think of cotyledon umbilicus. Potency again, everyone will shout about it. 30C you can use it, is more than safe to use. Worse in the morning and worse in the evening. Epitorium perf, lot of backache, and along with chills, they have lot of backache and they have lot of thirst. and they complain of lot of pain in the bones rather than muscles. Of course, everyone knows about epitorium perf, but yes, it is one of the beautiful remedy to be used in backache. Ipecac is same as epitorium perf, but neglected. Why? In Mitra Medica, it is clearly written that back pains or pains as if bones were all torn into pieces. So back pain as if broken. Back pain torn into pieces. You think of epitorium, but you never think of ipecac. Yes, one of the remedies ipecac as well. Concomitant, you can get of nausea. Uh, tongue is clean, but they have a lot of GI disturbances, or they complain of persistent, constant nausea throughout the day. Throughout the day, constant nausea. That indicates of ipecac. Macabre are the people who are orphan people. They feel like orphanage kid. So, and they all back pain relieved by motion. So before reaching for Rustox, consider for macabre also, because one of the remedies also macabre, where all the back pain is relieved by motion. But what is the mental sphere you can get of this patient? The more of forsaken feeling. They feel like no one is there for me. है ना? And how they are constitutionally, they are very weak and emaciated people. Tarantula hispanica. Tarantula is one of the remedy clearly written in Materia Medica. All the tumors of the spinal in the vertebral column. So any tumor on the vertebral column, and they have a lot of pain, the hyperesthesia due to the tumor, the excessive pain. They have like tingling, and they cannot even let them touch that area. The hypersensitiveness. Sorry. The hypersensitivity of tarantula is very, very marked, as it is very restless remedy. The slightest touch triggers the pain from chest or the heart, whatever. So these are all the confirmatory point if you examine tarantula in your clinic. Even in the coccyx, they have tailbone pain, which relieved by standing and worse by touch. Again, so worse by touch is the common keynote of this tarantula. That you, if there is a pain by touching, hypersensitive by touching, you can think of tarantula, where you can find the accompanied symptom, that is tumor in the vertebral column. Okay, another interscapular backaches, you find phosphorus along with leukorrhea symptoms or weakness. Sternum, you find inability to hold oneself. They are so weak, they cannot even hold their body. And the weakness also, there is a profound exhaustion because of the cough, because sternum coughs a lot. They are profound. They even in the TB cases, history of TB and not recovering, sternum met is one of the beautiful remedy for that. Even Kali carp along with it. Never since when pneumonia or the history of tuberculosis, of non-healing ulcers in the lung, still complains of tuberculosis. Kali carp is one of the beautiful remedy for that. Sternum met, talking about, they have a lot of severe weakness in the back. Same verolinum. Verolinum is one of the marked remedy where you fail to treat all the backaches, like tuberculum residum coach. Second remedy is verolinum. Verolinum has a breaking backache, broken as if, and same as if entim tart. Brinia. Bry means dry. So everything is dry. They have a lot of thirst, dryness of tongue, and the lying on the fitted part is ML. So any hard pressure, ML. Something hard under the bed, they feel better. The specific time of aggravation is 9 a.m., 9 p.m., 3 a.m., 3 p.m. Now, Brainia people are very irritable people. They are irritated to talk. But if you talk about the business, they'll be very, very active to talk about. So these are the people who loves to talk about the business. If it's there for benefit, they're ready to talk. But rather other topics, they irritate. Ah, don't talk to me. I have so much of pain here. This pain, nagging, or everything. Kalikab again, like I told you, Kalikab backaches are very much worse. And they actually tell you, the patient will tell Kalikab people, my back is broken into two. They feel so much of pain, as if my back is broken into two. And the pain goes back to the legs with the typical Kalikap symptoms. They can be fat, chilly people, and the lying on the fitted part aggravates. So, if you have read Colocynth, Colocynth is a wonderful remedy, we'll come to it. Whenever colocin fails to cure a backache or sciatica pain, Kali Cup cures. So when you find a Kali, when you given already colocin a lot of times and the patient was better, but again relapsed, give Kali Cup to cure the cat, cure that case. Next, syringomelia cases, syringe cases. So I'll tell you what all remedies are very, very important in these conditions. Like cecal core is the first of the remedy. Cecal core in syringomelia cases, where there is complaint of numbness, tingling. Syringomelia has the spinal. I don't know if everyone knows it. I hope everyone knows it about syringomelia cases, where you see this fluid-like cyst develop in the spinal cord. This is called spinal cord lesion, also known as syringomelia. In these conditions, few of the remedies are indicated in management of the syringomelia cases. At least you will be relieving the pain of this condition. Of course, this is a surgical condition, but yes, you can manage this case with homeopathic medicine as well. Like these are the remedies which I'm going to talk about. Cecal core complaints of numbness, tingling, icy cold in the limbs. They have burning sensation despite cold to touch. So they are cold to touch, but they have burning inside. Cramps, phosphorus, they complain of weakness, paralysis, progressive burning pains, and they are sensitive to light and sound, and emotionally they are very, very gets upset very easily. Cicuta have lot of rigidity, spasms, jerks in the limbs along with this lesion. Alumina, poor coordination. Even if you confirm how to confirm alumina in a clinic, you take a needle and you just to prick the feet. After, if you prick now, he will tell you after 2 to 3 minutes, yes, yes, now I feel that sensation of prick. This is called delayed response. So alumina, everything is delayed. Poor coordination, sluggishness, mental confusion, limb heaviness of the limbs. Natramure, where there is muscle wasting, lot of muscle wasting getting emaciated due to this cyst. Borax, they cannot go in a giant wheel. They have fear of downward motion, intense fear. They cannot tolerate more noise, lot of anxiety, heart coming out. Creosote, night aggravation, burning pains with ulcerative tendencies. Causticum, lot of weakness, stiffness, along with this paralytic symptoms, neuralgic pains, and rigidity. So these are the remedies very indicative in syringe cases, syringomelia cases. Next, we come in the most common disease condition we deal in clinics today. Piriformis syndrome. Actually, we don't understand. We just focus on sciatica, sciatica, sciatica. We don't ask the patient where is the pain starting from. Okay, from here, doctor, I am having pain. हाँ, आपको sciatica, you have sciatica only. But you need to understand where the location the pain is. Now, how? Kali iode is one of the beautiful remedy for piriformis syndrome. When the patient complains that this area particular is lot of paining, you focus on piriformis more muscle and advise the patient to get piriformis exercise at the house rather than focusing that you have sciatica, you have sciatica. Piriformis syndrome has to be treated, then only sciatica will be cured. So focus on more of piriformis muscle to treat the piriformis muscle. Hot and cold fermentation helps. Now the remedies which comes to piriformis, particularly in piriformis area where the patient, see the image I have kept, the patient complains over here, this area, a lot of pain. Sitting worsens the symptoms like Kali iode first. Hip pain radiating down to legs, severe sciatica, relief from walking and motion. Worse at night, worse lying on the affected side and being still. So rest also aggravates. Kali iode. Formication and crawling sensation they have in lower limb. Kali iode. Kali iode, like I told you already, that he is forced limping. He has so much of pain. So it immediately gives relief. McFoss, right-sided affected, cramping pain in right buttock. They complain of radiating pain of calf to feet and worse by prolonged exertion. Think of McFoss. Hypericum, any injury history, then you think of hypericum where there is lower limb tingling, burning, and pricking sensation. That's piriformis syndrome. Okay. Now, sciatica, the first remedy I've already told about Ammon muraticum. That so I'm not discussing again and again the same remedies because we have less time. Ammon Moore, like I told you, it's left-sided, long-lasting pains and cause lean ways, sideways while walking. They are one-sided. So much of pain. Nephilim, when to think of nephilim, where there is sciatica pain, right-sided or left-sided, no wonder the tingling is important here. Wherever there is a lot of tingling and numbness, think of Nephilim. That rules out. Tingling and numbness, colocynth also has it, but colocynth people will complain of pain more. Nephilim people will complain of tingling more plus pain. So there is a lot of numbness as well. Okay, so this differentiates. Calcarea carp, people who are working under more of water exposure. You know, they're washing clothes or being more of exposed to damp water or water staying water for longer periods. Then you think of calcarea carp. Euphorbium has a tearing and tingling pain which is relieved by motion, which is as similar as rustox and arsenic metallicum and right-sided. Not arsenic album I'm talking about. I'm talking about arsenic metallicum. Lumbar canal stenosis, when you see the MRIs and you're tired of giving all the remedies, Adamus is one of the most specific for lumbar canal stenosis cases, where they how the symptoms are. Symptoms are backache, very painful, and improves by heat. So they take a hot shower. In lumbar canal stenosis, that particular area, when hot shower, they feel much better and feels better while lying down as well. They have lower back pain with sharp shooting pain, like phytolacca, sharp shooting pains, and especially across the lumbar region, they complain of aching pain. They across the lumbar area, they keep on complaining. And MRI, you see lumbar canal stenosis, you can think of adamus. Hurra brasilis. Hurra brasilis comes where they have severe pains in lumbar region along with weakness, and they'll tell you splinter like pain in extremities and throbbing of the fingertips. The throbbing, when you see they have lumbar canal stenosis along with throbbing in the fingertips. Hurrah, will again potency 30 is enough. So severe pains, excruciating pain in lumbosacral when trying to lift as a weight. Lift a weight also, they have lot of pain when they try to lift something. And you see in the MRI, they have lumbar canal stenosis. When all the remedies fails, you can think of hora blastinoris. Salix fragilis in prolapse, disc prolapse cases, we call it an invisible handicap. This pains in salix fragilis are ache, lower backache on upon waking. So as soon as they wake up in the morning, they have a lot of pain in the lower. They have a lot of stiffness, and the pain extends from base of the spine down to the coccyx. So from up to down, and they represent a lot of. They feel like a lot of there is something like blockage kind of pain, block kind of pain. More remedies you see Califos, very restless patient, neuralgic pains, and the pain shoots to the sole of the foot. Ledampal pain runs from feet to upper. So ascending sciatica cases, you think of Ledampal, ascending sciatica. Ledampal and Ruta also ascending sciatica. So they'll come you and they'll tell you that my pain goes from down to upward. So two remedies, Ledampal and Ruta helps in these cases. Natramur, pain in the right hip and knee. Chronic sciatica with atrophy of the limbs, plumbum. Menianthus trifolata, of course, it's a wonderful remedy for headache cases, migraine, chronic migraine cases. But in sciatica also, and it is very wonderful remedy where the leg jerk upward when sitting. The leg jerk upward while sitting along with sciatica. Deep-seated pain feels as if in marrow of the bone, history of injury or contusion, Ruta is one of the remedy. Colocynth, you can see this lady. I asked the patient to do the same, bring the limb, drawing up upwards like this. Like they feel okay. Yes, doctor, I'm feeling much better. Simply, I give Colocynth. It's as simple as that. I never give a second thought. And I make the patient sit in the clinic itself. And within 4 to 5 doses, within 20 minutes, he says, I'm 100% better or 80% better. They feel immediately better. But this is a confirmation. This same confirmation is another remedy, Nephilim. Again, I'm telling. Nephilim also has same thing. But Nephilim complain more of numbness and colocin pain complain of more of shooting pains. Better by pressure, lying on the fitted side better. Worse by least motion and limbs drawn up like a hedgehog. That makes colocin and they screams on pain. So they are more focused with the pains. And of course, anger suppression, three remedies are there. Colo, staph, and chamomilla. So don't forget. Any history of ailments from anger, suppression of anger, any of the complaint comes to you, colo, chamomilla, and staph. These three remedies will clear up the case. Either of the one. Colo, staph, and chamomilla. Suppress ailment from suppressed anger. McFoss. McFoss keep on lamenting of pains like I discussed, right-sided hip lame, worse walking, tingling in the toes, legs ache after getting into the bed. So after when say lie down in the bed, they'll complain, oh, I'm having pain in my leg. So always talking about pain, McFoss. Right-sided sciatica cases. Diascoria, you see this position, I clinically confirm. If they have a sciatica pain, they have an abdominal pain, or they have a gallstone pain, or they have any diet error pain in the stomach, I tell them to just bend backward and they tell I'm much better. Simple. I give diascoria. So severe backache, drawing pain in sacrum and sacroiliac joint, dull pain in back of neck and stiff neck, spinal hyperesthesia, sharp pain in the back, bending backward, MLs, diascoria is the remedy. Again, potency you'll ask 30 or 200, whatever potency you can give. Valeriana, if I ask the patient to stretch the limb like this and he feels better, then definitely he's not Valeriana. If he stretches his leg and he feels worse, then he is Valeriana. So pain from calf to heel, right-sided sciatica, similar to Ruster's, left-sided, but I have seen Valeriana to act on left-sided as well, clinically. All the disc hernias in the MRI, when you see all the herniated disc, Valeriana, it's been written, wonderful remedy. Hysterical person, sciatica worse on standing, worse on the standing on the affected limb, sitting, resting, sciatica, motion, MLs like Brustox, Valeriana comes to the rescue. Phytolacca, shooting pains like electric shocks, aching feels better by elevating. So if they have heel pains also, that's why in the heel pain also it's a wonderful remedy. In plantar fasciitis also one of the specific remedy, Phytolacca. Neuralgia of toes, sharp cutting, drawing pains of the hip, legs drawn up, cannot touch the floor. So much of pain, hip pain, thigh pain on change of weather, worse with motion and extension. Think of Phytolacca. And they have so fear, they feel that due to pain, they're sure they will gonna die. Now, whenever colos in the phylum fails, what to give? Auramyode comes to the rescue. Auramyode confirmatory symptoms are restless, depression, open air ML by sitting ML, lying on the bed, aggravate. Sorry, open air ML by sitting and lying on the bed aggravates, and warmth aggravates. Warmth aggravates. Think of aurum iodatum. When you see a depressive case with sciatica, right-sided typically like colo and phylum symptoms. India metallicum, again, depression, mental depression with stiffness, lot of stiffness in the neck, lot of stiffness in the joints, in the back. But along with this, you have lot of mental depressive symptoms. They're sleepy, irritable headache. So Indium, one of the remedy is very helpful. Indigo, like I told you, indigo pricking in the nates in the buttocks is the keynote for this remedy, indigo remedy. Now, pain in limbs worse by every meal. So whenever he eats, he complains of pain. Whenever he eats, he complains of pain. That makes indigo one of the remedy. And the pain, patient will come and tell you, I have a pain from middle of the thigh to knee. From middle of the thigh to knee, I have only pain. This is the only remedy which covers, that is indigo. Better by walking and returning during the rest. In the afternoon, aggravation, immovable stiffness, aching, stinging, bruised pain in sciatic nerve, boring in the knee joint, pricking in the calf, worse by sitting and better by motion. So you can think this remedy in these cases where the typical they'll complain from pain which rises from middle of the thigh extending to the middle of the thigh and extending to knee. Then that's indigo. Ignatia. Winter is here. Think of Ignatia. Winter sciatica is Ignatia. Stiffness, nape of neck. They have painless nodules in the neck. You know, Ignatia has painless nodules in the neck. Sacral pain, squeezing pain in the morning. They can complain knife-like pains from back to thighs. Weak back with sciatica. Knotty swollen thighs, typically left-sided when sitting or rising. You can find swollen thighs. They have ulcer-like pain in the soles when walking. Heel, they feel a lot of burning at night, cold to touch when the heels are together. So a lot of sciatica with along with weakness. You can think of ignatia, especially winter sciatica. A few rubrics are here. Sciatic nerve left swelling of the limb with ignitia, single. Sciatic nerve alternating pains elsewhere, ignitia. Every winter sciatica is ignitia, and one of the remedies also there, Viscum album, Viscum album we'll talk about now. Pain sciatica in winter, ignitia, pain summer ML. Summer, so in summer they don't complain of pains. Hypersulf, ignitia, and rush in sciatica, the sciatica is disappear during summer. So they don't complain in summer. Salicylic acid is a wonderful remedy for rheumatoid arthritis. I'm sure everyone knows that. Typically, women who comes in climaxis stage, where after climbing menopausal state, after they get RA, is salicylic acid one of the remedy. Now, all complaints start with a history of foot sweat, suppressed foot sweat. Third, they have pain in sciatic nerve, which have a lot of burning in sciatic nerve. Burning, so much of burning, they feel like as if the foot is an ant inside an ant hill, and lot of perspiration. Even salicylic acid covers a symptom called necrosis of the tibia necrosis. So all the pain which is worse at night, sciatic nerve extending left-sided extending to knee, salicylic acid, sciatic nerve left-sided extending to toes tip off. So they'll complain that my tip of the toe from radiating pains, salicylic acid is one of the remedy. Elatrium. Elatrium is neglected remedy where there is a history of suppressed malaria, of quinine abuse. You can think of this remedy. Even diarrhea, it is a wonderful, it is called a squirting cucumber, I remember. It's a for diarrhea, it's a wonderful remedy. But for sciatica, also where there is left-sided sciatica, pain from hip to toes, even to the tip of toes. But this history is very important here. The suppressed malaria history, then only elatrium comes to the picture here. So even in jaundice of newborn infants, elatrium is indicated. Of course, lupulus is one of the beautiful remedy for jaundice of infants. It never ever fails. Lupulus is a wonderful drug. Then you can think of Myrica cerifera if lupulus fails in newborn jaundice of infants. Okay. Viscum album. Viscum album, if you see MRI, I don't know if you have seen MRI where you have find this bilateral sacralization of the spine. Many cases you find bilateral sacralization of spine in the MRI. Viscum album, and they have tearing, shooting pain in thighs and upper limbs. Viscum album is one of the remedy. Now, Viscum album is also for malignant hypertension plus sciatica plus hot flushes. Viscum album, malignant hypertension plus sciatica plus hot flushes is equal to Viscum album. Viscum album, sciatic nerve position change does not ML. So whatever position they turn, the pain does not get better. Viscum album. They feel like something hot, like a pincer, like chimta. They have that pain, like hot pincers catching that nerve. The tweezers, you can say tweezers. Yes, hot like a hot tweezers is touching that pain. Viscum album. Winter sciatica, Viscum album in ignitia. Otoria with it's a concomitant. With otitis media, they complain of sciatica. They have a lot of discharge. Viscum album. Left-sided typically otoria, ear discharge. Viscum album along with sciatica. Sciatica ailments from Holocene, Nephilim, Rustox, and Viscum album. So all complaints started after sciatica. Holocene, Nephilim, Rustox, and Viscum album are the remedies. Nux vomica. Nux vomica has fever with sciatica. Nux vomica has shooting pain in the thighs. Nux vomica will complain that I have a pain from trochanter extending to knee, hollow of knee. So they'll complain the pain starts from here and it goes to hollow of knee till here only. This is what nux vomica is. From here only. After that, it doesn't go. So pain, sciatica nerve, trochanter at night, single remedy nux vomica. Pain, trochanter extending to knee, nux vomica. Pain in thighs as if broken, nux vomica. Wrenching pain, shooting pain worse by movement and touch, nux vomica. Many other remedies are there. Gaultheria like inflammatory rheumatism, agaricus, arnica, ruta, we have talked about. Kalibai, yes, Kalibai, one of the remedies, shifting wandering pain. Left-sided sciatica. Tellurium met pains last from cervical to fifth dorsal vertebral. That's why tellurium met is one of the specific you can say in cervical spondylosis. From last cervical to the fifth dorsal vertebrae, very sensitive to worst touching. So even they cough, the pain aggravates. Even they sneeze, the pain aggravates. That's written in Tellurium metallicum. So there are many more remedies. I have brought this all remedies to prescribe, which will be helpful you to prescribe in the clinic, and it will be very easy now. Some repertory liners like lumbar pain, backache by leaning on the chair, Eupunium and sarsaparilla, streaking from pain, colocynth, ignitia, swelling on the limb plus sciatica, left-sided syphilitic sciatic pains, stylingia, standing aggravation, yeah, stretching the affected part of the leg, aggravated, valeriana, coldness, lot of coldness sensation, feet in heel in sciatica, agaricus, stool straining at they have lot of pain. So the patients are there. You come and that doctor saab, I cannot sit on the stool, I cannot strain because of so much of pain in my sciatic nerve. Naxwamica, Rustox, Platina, CP and Tellurium. Constipation. So along with sciatica, they complain of constipation. The remedy is Hamamelis, Lycopodium, Naxwamica, Plumbum, Ruta and Sulfur. Last, I would like to discuss about peroneal nerve damage. This is due to the sciatic nerve compression that it can be impacted, and they complain the most common that symptom is foot drop. So patient will complain of foot drop, difficulty lifting the front part of the foot because of the damage of peroneal nerve. Which remedies can help? These remedies. Alumina first. Alumina has weakness and heaviness in legs, difficulty in lifting the foot, feeling of stiffness and numbness, which actually helps in foot drop. Silicea, weakness and loss of power in limbs, inability to hold up the foot, numbness, and particularly in cold weather. Bryonia have sharp tearing pain in lower limbs, worse with movement, relief from rest, and very very sore. Chamomilla, burning pain along with peroneal nerve, hypersensitive to pain, intense irritability and restlessness. Naphyllum. Naphyllum is one of the main remedies in peroneal nerve damage where there is numbness, tingling, radiating down the leg, cramping and shooting sensation. Plumbum, paralytic weakness, inability to lift the foot, wasting and atrophy of the affected muscle, especially in the lower limbs. So I have written book. There are around 40 cases you can read. There are lumbar disc prolapse cases and everywhere. I'm sure whoever has read my book, it's available in Amazon, BJN website as well. You can read about these books. There's a WhatsApp channel where I share a lot of points, keynotes of Materia Medica for learning in clinical points, which can actually help you in prescribing. So you can join this WhatsApp channel. You can scan the QR code. You can join our Let's Discuss Failure group where we are so many people we're discussing cases with each other and helping each other basically in a field. That is the main motto. We want to continue this and we want to help each other because we know that everybody is not brilliant here. Everybody is working for humanity. Everybody wants to treat their patients in a better way. So there's a group to help each other. So you can join this group. You can listen to podcast. I have made a podcast, Homeopathy and Acutes. You can listen in Spotify, Apple Podcast. Do let me know how do you feel. Thank you for your feedback and thank you for this session. I would really want each and everyone's feedback. Whatever you have learned today, you can share on Instagram stories so everyone can learn, right? So the more you share, the more it is spread, and the more it is spread, the more they learn. So thank you so much, Dr. Yamni and Dr. Vaibhav has given me opportunity to speak about this topic today. And I'm grateful for each and everyone for being here. Thank you so much. I know there is so much of learning and there's so much to share. So I try my best to give you each and everything, whatever I have learned. I don't want to keep to me myself. I want to just spread it more. And now you have learned, you experience in your clinic, and you share to everyone. So it will spread like fire, and everyone will grow when we learn together. Thank you so much.
Thank you so very much, Dr. Jitesh. It was a wonderful session. And like you said, there is so much to learn, so much to share. And guys, I want to tell you that Dr. Jitesh, you might have seen some of his videos. I keep following him on Instagram, sometimes on Telegram. I'm not very active there, but on Instagram, I do watch his videos. It's very, very good. And he always says this and follow this that he would he's always open to share whatever he has learned, and it's so good to learn from him. So I also get to learn a lot from him. So please do follow him on Instagram, on Telegram channel. Like he said, I just followed your Telegram channel right now, failure cases. I will also share. And it's always good to share our failures, our learnings, so that even if you share your learnings or cases, you would definitely learn something new, even if it is already you have done something about it. So I just believe in this. And Dr. Jitesh, I can't thank you enough. Thank you is chota word, but thank you so much for sharing it.
No, thank you so much. I just wanted to give my best that everyone, because this is a common ailment, right? Every day, it's a bread and butter, you can say.
Yes.
Every one patient enters and see, I have a back pain. I have a back pain. Can you treat my back pain? Can you treat my back pain?
True.
But how to treat? You need to understand the zest of the remedy to treat first. Now, how to understand the zest unless you do a good case taking? Then
Yes.
only will reach to that remedy.
Yes. And like you said, where you have told about remedies where which part is affected, that is also very important. So if you take good case taking, you will see clinically also that which part is affected, and then in our remedies it is written, but we don't study enough. Dr. Jitesh has given me one very nice learning, that padhna chahiye, bahut padhna chahiye. We
So
should study very
I
carefully.
wanted to share the differentiation because I myself has gone stuck thousand of times where I stuck. Are Colosin do ki Naphylam do? Are what should I do? So I when I see practically by admitting the patient, I have been like well experienced now that what to be prescribed, Colo or Naphylam, irrespective of potency. If that remedy is the same, you just simply scale up line wise and you'll get the result on the spot. That's what I have learned now.
True, true. The potency comes later. We are
Yes, the remedy should be right first.
remedy
You
should be
can
right.
play with the potency. You can start with LM 1, 2, 3. Then, if you're confident about the remedy, you shoot up till 30, 200. You give 1M, 10M na. But you should be confident on what remedy that patient really requires. That's more important here, not about potency. Potency, you start with 6, you start with 30. Patient will tell, if the remedy is right, he'll tell you, sir, I'm 5% better. Sir, I'm 10% better. I'm
True.
50% better. I'm 80%. Then gradually you scale up and raise up your scale.
Yes. Even if you give the wrong potency for that instance, there is nothing wrong and right. But
Yes,
even if
yes, there
you,
is nothing wrong. The rule is there
yes,
is no rule. You can have to practice. See,
yes,
we are practitioners. We practice and we learn from the patients. Patients are the best educators. I have seen patients getting aggravated by LM1, but they're getting better by LM2. What to do? So
yes,
this way, the many things have been taught by patient by ourselves. Every individual has their own susceptibility. Many patients I had to give olfaction as well because of the hypochondriac cases. If you're dealing with hypochondriac cases, the olfaction is also, but still they complain, I'm getting aggravated by smelling also. This shows their hypersensitivity. So this way I have learned a lot of things. And Hahnemann used a lot of cases of olfaction. He treated a lot of cases by olfaction.
yes. I guess the only rule in homeopathy in life also is to be
Yes,
open to learn,
yes,
to
yes,
integrate, and
yes,
just try yourself and do what suits you. I
yes.
always feel that homeopaths also, their practice is also individualistic, like the case. So
True,
whatever suits you, by whatever method or tool you get results. If you think that materia medica is helping, take help. If you think repertory is helping, take help. If you think therapeutics is helping, take help. That is not a problem. Our sole aim is to help the patient.
true.
So please practice, and we are getting so many good feedbacks. Please do share it on Instagram and YouTube also. This session will be there, so don't worry. I will put this in the main playlist so that you can watch it easily. Thank you so very much for attending and sharing your questions and your feedback. Thank you so much, and once again, Dr. Jitesh,
Thank
thank
you
you.
so much. Thank you. Thank you.
Thank
Thank
you.
you.
And we are looking forward to have you again whenever you have
Surely,
time.
surely. It will be my pleasure. Thank you.
Thank you. Thanks, everyone, and have a great Sunday. We had a very, very good start. Hope the rest of the day also goes very well for you. Thank you. So, bye bye for now, and we will soon meet up in the next.
I want to especially thanks my Turkish friends are here.
Okay.
My colleagues are Turkish colleagues. Thank you, Dr. Sukru, for being here. And he's there. He's mute actually. Dr.
Dr.
Sukru, you
Sukru?
can speak.
Yeah, you can please speak.
Hello, Dr. Jitesh is my friend and our best teacher for my country, for my people, because we are very new in homeopathy, and Dr. Jitesh always help us whenever we need something to learn. He back to say something, and we are growing with him. So thank you very much, Dr. Jitesh, and
Thank you.
thank you,
Thank you so much, Dr.
madam.
Sutru, for joining. Thank you.
Thank
My
Thank
you,
you.
Dr.
Turkish friends are here. I'm so glad everyone participated. And thank you so much for being here today. Thank you.
Thank you.
Thank you. We are very glad to see you here. And like you said, Dr. Jitesh always helps whenever it is required. Thank you so much. So happy to see all of you here. Okay. So
Thank you.
bye-bye for now. See you soon.